Well, it becomes increasingly clear that patients with chronic progressive neurological disease have non-motor symptoms. That is to say, patients with Parkinson's disease suffer from sleep disturbances, urinary incontinence and constipation, and patients with multiple sclerosis have fatigue and mood swings, and ALS patients suffer from pain more than we expected. And it is therefore of utmost importance to see these patients, to follow up these patients on a regular basis, evaluate and treat these symptoms, but at the same time also pay attention to the burden of their carers. It has been shown, there's really evidence that this approach will improve their quality of life and daily functioning. Well, you know, the individual course of many chronic progressive neurological diseases is unpredictable, and I'm in particular referring to Parkinson's disease and multiple sclerosis, and this withholds doctors from offering palliative care to these patients at an early stage, whereas these patients have complex care needs just as ALS patients do, and that means that they have to anticipate and the doctors have to anticipate together with the patients on these future care needs as early as possible in the disease course. Well, a lot, because these patients were quite willing to share their preferences and express their needs with us. So we learned a lot about what good ACP would be for ALS patients. Well, what we do, our routine is that after the neurologist has broken the bad news to the patients, we, the neurologists, refer those patients for multidisciplinary care. And within 2 weeks, the lead of the multidisciplinary care team, and in our country a rehabilitation physician does the intake and schedules 3 monthly visits with the patients, and often also with the carers. And during these follow-up visits, they do measurements, for instance, vital capacity, and take the history, of course. And based on these measurements, the urgency, you know, when the vital capacity is very low, of course, or the complaints the patients share with that doctor, like swallowing difficulty or increasing difficulty with walking, then they discuss options like a peg if the swallowing difficulties are getting worse, or a wheelchair or something like that. And a number of these ALS patients were interviewed in depth by a PhD student, and they said that they were quite satisfied with this approach. One of them even called it looking just beyond the horizon, which is a nice expression. I mean, they want to anticipate on their future care needs, but not too far ahead. Well, we only investigated a small cohort of patients with Parkinson's disease, 20 in total. There were patients who heard a diagnosis only recently, about a year ago, and there were a number of patients in more advanced stages of the disease. But all of them, also the patients who had recently heard a diagnosis, expressed the wish, you know, to discuss their future needs. And they were all very anxious and uncertain about their future, whether they would become wheelchair bound, whether they would develop dementia, things like that. So we concluded from that it's that they have the same needs as patients with ALS, for instance, or with brain tumor with a much more progressive disease course. But I have to say that I don't know whether this also holds true for all Parkinson's patients, so we have to do more further research into this. Yeah, well, that is a very interesting and very relevant question. We recently conducted a survey amongst neurologists, both residents and consultants, raising questions about their conversations on treatment restrictions in patients with Parkinson's disease, multiple sclerosis, and brain tumor. And about half of these neurologists, residents and consultants expressed a wish to develop more communication skills. But there was also another aspect regarding this survey. They wrote down that they have these conversations with Parkinson's disease and multiple sclerosis patients on treatment restrictions only in final stages of the disease. And at that time, most of these patients are severely cognitively impaired, which hampers communication, of course. So I mentioned before that it's very early to introduce ACP early in the disease process. But whether this also holds for neurologists in other European countries, I don't know, but I'm pretty sure that there is room for improvement with regard to the care, especially palliative care in patients with chronic progressive neurological disease across Europe.